Infant deaths part 2, I am going to discuss about sudden infant death syndrome, or in other words SIDS. There are certain synonyms: cot deaths, crib deaths, because such babies are going to die during sleep. And also I have included certain clauses here and there. Please have a look. Each term has a significant importance. What are the learning outcomes? Define the term SIDS, how it is diagnosed, discuss the risk factors of SIDS and the cause, if any, discuss the medical legal significance of SIDS. What is the definition? It is a sudden death of a normal healthy infant. There are certain key features that you have to have. Should be sudden, and also death of a normal healthy infant. And the age of the baby should be less than 1 year of age. And also with all the investigations, that means scrutinizing of clinical history, and also doing the crime scene investigation, doing a very complete post-mortem examination, all the tests along with ancillary testing, everything should be negative to diagnose a case of SIDS. It's time to study about the cause for SIDS. Now, importantly, there is no identifiable cause for SIDS. You have to remember it. No cause yet had been identified. Whereas to that, there are many risk factors identified. Out of those risk factors, there are modifiable risk factors and also risk factors that we can't do anything. Example, being a male, being one of the twin, likewise. So what are the modifiable risk factors? Sleeping position, maternal smoking, co-sleeping, and so these are the things that we have to think about as risk factors. There is a huge list, but I have mentioned a very few here. Right, so now I have categorized it according to the groups. That means infant or baby factors. So male sex, important, and also mild respiratory tract infection, brain abnormalities, and what do you think about the peak age? We are going to discuss it very soon. And about maternal factors such as smoking during the pregnancy, substances of abuse, young maternal age, etc. And also many other things as well. As per the environmental factors, prone or side sleeping position, soft bedding, and also soft pillows, stuffed toys, bed sharing, overheating, exposure to second-hand smoking as well, and also unsafe sleep surfaces such as armchairs and couches. Right, so now what is the peak duration to have SIDS death? Now, different places had been mentioned different figures. However, the peak duration is 2 to 5 months within the first year of life. It is mentioned that it has a bell-shaped curve when consider the frequency of or the number of deaths, right? So now during the first month of life, SIDS are rare. I can't say no, but the number is less. But now one thing that I want to tell, but during this time, we can get lots of what kind of deaths? Infanticide cases, right? So now this is a bell-shaped curve where you get the peak number of deaths or the peak duration is 2 to 5 months. Right, so now however, now if there is something called SIDS, we have to learn it more. Now there are certain mechanisms explained to the causation of SIDS, but this is not a real causation, all right? So the mechanisms. The favorite model is triple risk model. Here, now they have categorized certain risk factors into sets in a Venn diagram. So vulnerable infant, critical development stage, and also external stresses. So now in the Venn diagram, now there is a common place or overlapping place here where you get SIDS death. Now in the first circle you can see now critical period development, that means for 6 months, and also in case of modifiable external stresses such as bed sharing, smoking and everything, and importantly underlying vulnerability of the infant, so that means abnormalities in the regulation of cardiac or respiratory center or sleep, the apnea, that means lack of sleep arousal patterns. So these are the vulnerable vulnerable infant factors. So once all three are overlapped, getting a common point, so this is the point where you get SIDS death. So this is a model that they have put forwarded to explain the SIDS death. Let's discuss further about developmental timing. SIDS usually happens between the first 6 months and peaks 2 to 5 months of life, and this is the period of important developmental stages are happening in cardiac and ventilatory centers, and also sleep-wake patterns are developed. So now you can understand in these individuals there may be some kind of deficiency, and also this is the critical period of autonomic development as well. There are many theories presented to explain the SIDS. However, out of those, the poor respiratory drive has been recognized for some extent. Now here, this is the explanation. All infants have apnea during sleep. That is normal. However, but some get prolonged apnea due to the poor mechanism of arousal system. So it causes prolonged apnea, causing progressive hypoxia leading to cardiac arrest. So this is one of the mechanisms that are going to be explained about SIDS. Learning about special features of SIDS death. It is an acceptable cause of death. So very similar to congenital heart disease or meningitis, very similarly SIDS is an accepted cause of death. However, to diagnose a case of SIDS, you have to exclude all the other possible causes in the groups of accident, natural diseases, and most importantly, exclusion of a possible hidden case of homicide should be done. Now you can understand, to kill an infant, we should not have much force. So there may be very little injuries on the face or on the neck, right? So there may be cases of hidden homicidal cases. And also it typically occurs associated with a period of sleep. That's why SIDS is a synonym to cot death or crib death. Usually the baby is fed and put to sleep and we find the baby dead. As per the usual history again, the brief history, actually the child is quite well and maybe 5 minutes ago. However, now with the sleep, we found the baby is dead. The previously very well, but there may be a trivial upper respiratory tract infection or bowel upset as well. However, infant put to sleep and found dead in sleep. Death in the first half of the day or morning is quite common. And also SIDS are rare during the first month of life, and also it is an accepted fact that 80 to 90% of SIDS cases can be prevented with safe sleep practices. So now, how to reduce the risk of SIDS? Now, as you can understand, so this is the correct position. Now, prone position is incorrect and lateral positions are also incorrect. Now, this is how it can be explained. Now, as you can see here, the trachea is on the esophagus when the baby is on supine position. Alright, so now there is no pressure applied to the trachea. So safe practice. But when it comes to this position or the supine position, the trachea can be pressed by the esophagus, causing some kind of difficulty. So that's why it's mentioned as back to sleep and tummy to play. Now we are going to learn about postmortem features. So what are the postmortem features? It should be a negative autopsy, definitely. However, there may be perinasal or oral blood tinged fluid, and also petechial hemorrhages over the thymus, and also visceral pleura and epicardium, etc. Alright, so now we have started like negative autopsy, but there may be lots of non-specific findings such as just mild bleeding and also petechial hemorrhages over the thymus. So this is an important part. What are the differential diagnosis and medico-legal important features in relation to SIDS? Now you have to always exclude injuries such as suffocation, overlaying, or the possibility of child abuse. You have to definitely exclude. And also you have to exclude about natural diseases as well, and importantly you have to exclude hidden cases of homicides as well. And it should be mentioned that in Sri Lanka it's difficult to diagnose cases of SIDS because we don't have much facilities such as no metabolic screening tests available, and we can't do a lot of genetic studies and etc. So as a result, usually in Sri Lanka we tend not to give the cause of death as SIDS. And what do you think? With a case of SIDS, usually mothers feel bad. They feel guilty that I could have done something to prevent the death, right? So we have to have counseling services for that. So now just to mention that, so this is the thymus with lots of petechial hemorrhages. Summary charts. Now SIDS. So what's the definition? It is the sudden death of a normal healthy infant under 1 year of age which remains unexplained with all possible investigations, post-mortem, scene examination, scrutinizing of clinical history, and also with all the ancillary testings as well. Right? So what are the medico-legal issues? If you get multiple deaths, unexplained deaths in a family, you have to think about hidden cases of homicide as well, but it is not always, right? So there are cases with multiple deaths in a single family, but it is purely with metabolic diseases. And also the term SIDS is an accepted cause of death. So what are the post-mortem features? It should be a negative autopsy, but there may be non-specific findings such as thymal, petechial hemorrhages, facial congestion, etc. And you know that there is no identifiable cause for that, but there are multiple risk factors. All right. So what are the common risk factors? Being a male person, and also during the winter, and being one of the twins, etc., etc. Right. So now it's time to practice certain MCQs with infant deaths. That means in relation to infanticide and also with SIDS. Infanticide is an accepted cause of death. What do you think? Infanticide is an accepted cause of death. It is incorrect, right? So this is just a term, but if you get the question like this, SIDS is an accepted cause of death, yes, then it's correct. The punishment for the mother, if proven, is murder in infanticide. It is incorrect. The reason is it is not murder because the intention is not there. Mother kills the baby because of the disturbed mindset with the pregnancy and lactation. So as a result, mother gets a lesser punishment. That means culpable homicide, not amounting to murder, not the murder. So incorrect. The intention is clearly malicious in cases of infanticide. No, mother is ill, that's why mother is going to kill the baby. So it is incorrect. Now, if the intention is malicious and also mother is going to kill one of the babies, yes, now mother should get the punishment of murder. Hydrostatic test is diagnostic. No, it's incorrect. It's just a pointer. So it's not a diagnostic test. Ossification centers should be dissected to estimate the age in cases of infanticide. Yes, it is a fact. Killing of an infant by the biological father is infanticide. No, it should be always the biological mother. An adoptive mother can be charged for infanticide. What do you think? It's incorrect, definitely. Alright, adoptive mother should not have the effects or mental instability with the effects of pregnancy and lactation. So it's incorrect. Milk in the stomach confirms a live birth. Yes, definitely correct. But if you get blood in the stomach or saliva, meconium or anything else, right, so it is incorrect. But here if you get milk and foreign bodies, that means if a newborn is going to bury somewhere, right, still baby is going to breathe, so there may be sand and other foreign body. So in this case, yes, live birth correct. If the JMO can confirm a stillbirth, that brings to the end of the investigation of a possible case of infanticide. Yes, it's very correct, right? So now to kill a baby, the baby should be in live state. To charge for the offence of infanticide, the live birth should be proven beyond reasonable doubt. Yes, that's true. Now, if you are going to allegate an innocent mother, that means if the baby born dead, but you are going to tell that the baby was born alive, right? So you are going to point out an innocent mother. So this fact is very correct, right? So now we have an immense responsibility to tell whether the baby was born alive or not. Infanticide is considered as a case of culpable homicide. Yes, that's true. All right. So culpable homicide is the category where you get murder and culpable homicide not amounting to murder, right? So now this is the common category. So this is correct. Osborne no-touch system is employed during the post-mortem examination. Yes, to perform the hydrostatic test. Yes, it's correct. To diagnose a case of infanticide, the opinion of psychiatrist is mandatory. What do you think? Definitely correct, right? So to tell the imbalance of the mental state of the mother due to the pregnancy and lactation, yes, it should be done by a psychiatrist. Self-delivery is a defense for manual strangulation. Definitely. Not feeding is a defense for loss of consciousness after the self-delivery. Again, correct. Now, this is killing of the baby by commission. This is an example for killing of the baby with omission. Obtaining of DNA from the baby is an important step. Yes, definitely. Sometimes we never know about the mother. One day we can trace the mother. So in this case, we should have DNA with us from the baby. SIDS is an accepted cause of death. Yes, definitely. The cause for SIDS is unknown. Very correct, right? But there are lots of risk factors. Co-sleeping is a risk factor for SIDS. Very correct. Being one of a twin is a risk factor for SIDS. Yes, very correct. Being a female is a risk factor. It is incorrect. Male. So this is incorrect. It is possible to predict which children are vulnerable to SIDS. No, it's incorrect, right? So we can't tell which child is going to die with SIDS. So that's why it is termed as sudden. All right. Negative autopsy is essential to diagnose a case of SIDS. Yes, definitely. Thymal hemorrhages are common to see. Yes, definitely. Death of an infant occurring during the awake state in case of SIDS. No, it's incorrect. Usually, there may be exceptions, but it's for your level, the death should happen during the sleep. The number of deaths are more in summer? No, it is more in winter. More than one infant death in a single family is suspicious for concealed homicide. Yes, you have to have that mentality. SIDS deaths are peak at 9 months. It is incorrect, right? So by the time 2 to 5 months, usually the peak time, and by the time 6, now the frequency will be getting less and less. Thank you.